It's Dr. Trudy Ufondo of Snowspirations, Global Health Solutions. Good afternoon, good evening, depending on where you reside. It's a privilege and it's an honor to share my 30 minutes lunchtime break with our audience and answer a couple of your questions. So please, when you come in, announce your location. Tell me who you are. Let me know who you are. Then we're going to start. And the next 30 minutes, I'm going to provide you feedbacks. Now, remember, we have different platforms you can participate in. The aim of my organization is to help, to use education, to use knowledge, to change the narration in our communities. So if you follow me, thank you so much for the confidence, for the faith you have in me. I appreciate you spending your time to listen in. Thank you so much for coming this afternoon. Please, as soon as possible, when you can, start asking your questions. If you can see me, if you can hear me clearly, please announce your presence. Follow my admin. My admin is going to help you this afternoon. Now, remember, this particular broadcast is the lunch time open clinic. I have my own set clinics, which runs on Mondays, Wednesdays, Fridays, Saturdays, and Sundays. So if you're not yet a member of our group, Snowspirations, the name of our group is Snowspirations Health Hub. We also have a page, and we are also in YouTube. If you go to YouTube, you search for Snowspirations channels. If you're in Instagram, also search for Snowspirations. So regardless of the platform you belong to, you can get help. For the month of August, we've selected ovulation as a topic of great interest. So we're going to dissect ovulation to the barest minimum. We are going to release the basic knowledge about ovulation that can help you to get the knowledge, which can help you to change your attitude, which can help you to change your practices and your perception, so that ultimately you can become a mother exactly how God planned it. But this afternoon, I'm going to run an open clinic, and my open clinic is very simple. Once you can see me, once you're fully settled, start asking your questions. If you need help, my admin is going to attend to you. So in the next 30 minutes, I'm going to run this clinic, and I'm just going to look around and provide you feedback. So the clinic is going to start about now. The title for this month's masterclass is Ovulation and Pregnancy Boot Camp. So in boot camp, we go above and beyond to acquire the tools we need so we can become. So if you're not too sure about ovulation, if you're confused, or if you were told you have ovulatory problems, you don't want to miss the event. It's going to be on the last Sunday of August by 9 p.m. Nigerian time. You will be blessed. You don't want to miss it. So keep your dates open, okay? But right now, let me take care of your questions. Okay, please, when you come in, start asking your questions. Dr. Ndiche is going to be in the background, providing you feedbacks. But I'm searching for questions so I can teach you what you need to know, okay? So once you come in and you're fully settled, start asking your questions. Now, we also have a new approach to teaching. If you love staying late nights, you can also benefit from my live YouTube broadcast. So it's going to start today in earnest. Now, if you spend maybe 30 minutes before you go to bed, because by your time, by your night, it will be my evening. So if you can stay up to maybe 11 or 12 p.m. before you go to bed, if you're someone that sleeps very late, you can tune into our YouTube channel. We are going to pick a particular topic to make very simple. Today's topic is very, very interesting. So one of our members is asking if a woman in her 60s who is already menopausal, if she can become pregnant naturally. if she can become pregnant with IVF and if she can be a mother. You don't want to miss this. It's very important. So if you stay late night, keep in touch with this clinic, and I'm going to teach you guys on that. But right now, let's see what we have. Okay, the clinic is open, and I'm searching for questions. So please go ahead and ask your question. Okay, let's see. Okay, good evening, doc. Your cycle changed from 26 to 21 days. This is a very important question. Remember, one of the tools you need to have to improve your chances of understanding your body is your cycle. Your cycle is the interval between your two bleeding days. Your two bleeding days will mark the beginning of your cycle and the end of your cycle. And I'm going to give you an example. If you bled on the 15th of July, 2021, you bled for 3 days and you stopped, and you're going to bleed again on the 15th of August. When you count the number of days between the 15th of July and the 15th of August, that's your cycle. Now we have the regular cycle. It's a range. It's not constant. When your cycle is within 21 to 35 days, it's considered normal. So if you bleed every 21 days, it's your normal. If you bleed every 35 days, it's your normal. Now, this is what I want you to understand. Sometimes some factors can change the exact days. In your own situation, you switch from 26 to 21 days. Guess what? 21 days is still within the normal range. I would have been worried if you switch from 26 to 20 days, or 18 days, or 10 days, or 36 days, or 45 days. But since you switched between 26 to 21, it's still okay. I'm not worried about it, okay? Make sure you register for the ovulation bootcamp. You're going to learn a lot. One of the tools you're going to use during that ovulation teaching is what? Our cycle. You need to know the regular cycle. You need to know the abnormal cycle. You need to know about your bleeding days. Very important. Okay, guys, let's continue. Keep asking your questions, please. Remember, you can come in for 1 week. You can come in for 1 month. You can come in for 3 months. You can come in for 6 months. And if you're pregnant, you can also go to our ANC lounge. And if you want to be a mother in 2022, you can also join our Believing for Baby group in Telegram, okay? But right now, it's time for questions. So guys, keep asking your questions, and I'll keep providing you feedbacks. Okay, let's see. Can someone at 39 with PCOS become pregnant without IVF? Yes, you can become pregnant anytime, even with your pathologies, even with your difficulties, even with things that will delay you. But here's though, my sister, I love evidence-based teaching. I'm going to pick on a couple of factors you need to be conversant with. Number one, your age. You are 39. That means you are above 35. That means your fertility is reduced. Now, you also have another concern. You have PCOS. If I understand correctly, you wanted to write PCOS, right? PCOS stands for polycystic ovarian syndrome. Polycystic ovarian syndrome is a fertility issue that can stop a woman from becoming pregnant. So even without your age, if you only have polycystic ovarian syndrome, you already start having problems. So what you need to do, if you genuinely want to be a mother, is to change the way you approach your infertility. Now you are already looking at minusing IVF. Now, I don't know if they've given you treatment. So you need to see a fertility specialist. We can place you on some hormonal drugs. We can use some anti-diabetic drugs. But importantly, you can also help by watching your body weight. So adopting good, healthy lifestyle, drinking a lot of water, avoiding alcohol, eating good food, exercising. Your body weight is very important in management of polycystic ovarian syndrome. Why is this important? in polycystic ovarian syndrome, instead of having more female-based hormones, you have more androgens. Androgens are male-dominated hormones. When you have these androgens, they will affect the function of your hormones. Your hormones is ordinarily supposed to help you to ovulate. So one of the big problems we have in polycystic ovarian syndrome is lack of ovulation. If you can't ovulate, you cannot become pregnant. When we go to your ovaries, we have multiple cysts, which will prevent you from ovulating properly. Now, for you to get help, you need to see a fertility specialist. A fertility specialist will also refer you to an endocrinologist. An endocrinologist is also someone that will work with a fertility specialist to figure out how they can help you. Now, besides the drugs we will give you, you have to exercise, you have to avoid stress, you have to eat properly, then you must sleep. These are the things you can do by yourself to help yourself to get help. Ultimately, because of your age, you might be a good candidate for IVF. But here is the deal. You read the testimony today. A particular woman subscribed, but she didn't have the money to go for the IVF and all the planning. Guess what she did? She went back home and she continued practicing PPP. PPP works. The first P is praying. Prayer works. So even when you don't have money, even when you're not in a good place, even when they told you you have this problem, you have that problem, continue praying, continue playing. Playing means make love 48 hourly. See your fertility specialist. You will become. There is no never in becoming a mother. The day you might think you are not going to get pregnant might be the day you get pregnant. So even when you're searching for money, even when you don't have the money to go for what you need, keep on making love with your partner. You can become pregnant. Okay, so let's continue, guys. Okay. Okay, guys, let's see what we have. Okay, I'm searching for questions and follow Dr. Ndiche's feedback and you'll be fine. So I still have a couple of time to attend to you guys. So guys, keep asking your questions. Make sure your questions are very brief so we can give other people an opportunity, okay? If you need help, follow my admin. My admin is gonna help you. Okay, so I'm looking for questions. Make sure you know how to calculate your BMI. Your BMI is very important. Your BMI is what we call body mass index. Your BMI is gonna help us to know if you're underweight, if you're normal weight, if you're overweight, or if you have obesity. Okay, Doc, what's the cause of brownish spotting in first trimester, even when the doctor says everything is fine? Now, in pregnancy, there are a couple of things you need to be conversant with. Anytime you notice any discharge, which is not clear, normally as a woman, every woman discharges, but that's called physiologic discharge. It's clear. It's not itchy, it's not smelly, it's not a lot. It's the way of your vagina to take care of itself. It's the way of the cervix to take care of itself. It's the way of the womb to take care of itself. Now we begin to get worried when your discharge is discolored, when it's brown, when it's red, when it's yellow, when it's greenish, when it's foul smelling, when it's a lot, then it's possible that something is going on. Now you are pregnant in your first trimester. First trimester is when most complications in pregnancy will happen. First trimester is when most women will have miscarriages. Now, what you need to do as a rule of thumb in this group is to enroll in our ANC. We've noticed that so many women look for babies for a long time. When they succeed in becoming pregnant, they run away until they begin to have problems. They begin to come back and complain of bleeding and spotting and pain. By the time they are complaining about that, it's already late. So please, the first insurance you can give your baby is to do what? Enroll in our ANC. It's gonna help you a lot. We are gonna work with you until you have your baby. So my sister, in as much as your doctor has already told you everything is fine, the question is, have they investigated? Have they ruled out infection? Have they ruled out bleeding? It's important that when you're pregnant, you have the attention of a caring doctor. The reason is because 9 months is a long time. You do not want to take chances to lose your baby. So enroll in our ANC, then go back to your doctor for proper assessment. Okay, let's see what we have. Okay, let's see. What will make a lady of 26 years old to have cessation of her period for 2 months? Not that she's pregnant. Now, there are so many factors that can lead to what you are having. What you are having is what we call amenorrhea, absence of bleeding. There are so many factors that can lead to this in a 26-year-old. Number 1, stress. Number 2, emotional disturbance. Number 3, sports. Number 4, heartbreak. Number 5, use of hormonal drugs. Number 6, weight loss. Number 7, weight gain. Any of the things I mentioned can suddenly affect your period from coming out. It's now 2 months. If your period doesn't come out next month, please book an appointment, see a doctor so we can confirm the problem you're having. So anything I mentioned can lead to amenorrhea. Anything. But the fact you are not bleeding, but subsequently you were bleeding, it's something we need to investigate. Once the amenorrhea has lasted up to 3 months, we need to know why. Especially if you want to have a baby. Once we notice anything in your body, it's a signal that something is going on. So we need to correct that, okay? So you need to book an appointment with your gynecologist and we make sure that you're in a good place, okay? Okay, let's see. How necessary is progesterone, E2, and HSG test in early pregnancy? Now listen to me carefully. Pregnancies can be classified in different states. If you have a smooth going pregnancy, no problem, no issues, you don't have to go for all this. Your hormonal assay is something we should have done prior to now. Progesterone is a very important hormone in maintaining your pregnancy. When your progesterone level is not adequate, you can lose that pregnancy. Why? Progesterone will make sure that you have adequate thickness of your endometrium. Your endometrium is the cover of your womb. When your progesterone level is not adequate, that means it's little, it's reduced, you can have miscarriage. So it's important to make sure that all your hormones are within the normal range. Now, HCG is the test we use in confirming your pregnancy. That HCG stands for human chorionic gonadotropin. It's the so-called pregnancy hormone we check in your urine, we check in your blood. So it's important that when you are pregnant, you conduct 3 tests: your urine test, your blood test, and your ultrasound. When we are checking your urine test, we are checking your urine, human chorionic gonadotropin. When we check that, that's a qualitative test. The urine is going to tell us you are pregnant or you're not pregnant. But you need to step up and go for blood test. Blood test is both qualitative test and quantitative test. When you are pregnant and your pregnancy is going okay, it's expected that the level of your beta HCG will be rising. Matter of fact, it's supposed to be doubling every 72 hours. Now, if we check your blood and it's not doubling, it's possible you are losing the baby. It's expected that every woman that is pregnant and the pregnancy is going okay, your beta HCG should be doubling every 72 hours. So it's important, very important. Now, listen to me carefully. I know some of you can afford to go for ANC. You see, you don't gain anything sitting on the fence. I can provide you all the beautiful answer to your question. But my sister, you're pregnant. Why don't you join our ANC group so you can have access to me and Dr. Ndiche so that every day we can attend to your needs? Instead of sitting on the fence and you have complications and you don't know you need to go to the doctors and you lose your baby and you begin to complain and you begin to call God. You cannot afford to lose your baby because of your carelessness. So invest in your pregnancy. Admin, please share the links of the ANC group. Don't say you don't know. Some people claim they don't know, but you follow me every day. There are opportunities for everybody in the group to get the knowledge they need so they can become. If you need help, please go through the right channel, not my inbox. If you need to talk to me, then you come in from 3 months up. If you need to chat and we can figure out what the problem is, then you start from 1 week. It's either you come in for 1 week or you come in for 1 month, and together we can overcome. Everybody can get help in this group. We are for everybody. We don't discriminate. But if you don't step up, you cannot get the help you need. There are so many amazing doctors out there in Nigeria doing amazing things. We can refer you to them. You can be a mother in 2022. You can have 1 baby. You can have 2 babies. You can have 3 babies. You can have 4 babies at a go. It has happened before. It's possible that out of the 66 of you in this group, if assuming 50 people are looking for babies, by this time next year, you will be a mother. You are gonna have your baby in your hand. But guess what? The only difference is action. So many women show up and claim and tap all the blessings, but they are not practicing praying. They are not playing. They are not they don't have a fertility specialist. If you wanna be a mother in 2022 and you are having challenges in becoming pregnant, if you don't have a fertility specialist now, you are delaying. You cannot achieve this alone by yourself. You need help. So the earlier you get help, the better. This is August. By the time we start counting down in ember months, it's already late. So no, I'm good. I don't need food. Thank you so much. I appreciate. So please, and please, let's be the difference. That's actually amazing people. They are going about offering food to the homeless. So in this lake, there are so many homeless people that come around. So think about that. They are going about looking for people to help. This is how to love. And we love you in this group. So let's continue, guys. I think the weather is even about changing. So I have to hurry so I don't get beat up by the rain. Okay, I've already answered that. So guys, let's quickly wrap up so I can, go back to my base. I have about 7 more minutes. So hopefully we're gonna tidy up. What's the normal fetal weight for vaginal delivery? So this is a very technical question, okay? Your baby weight will be commensurate with your BMI. So I can't give you a generic number if I don't know your BMI. So when you register for your ANC, the nurses at the clinic will check your height, they will check your weight, they will calculate your BMI, then they will look at your body weight and tell you the exact body weight you need. So your BMI is unique to your height and your weight. So the amount of weight you need to add in pregnancy is dependent on the BMI of reporting to the clinic when you were confirmed pregnant. Very, very, very important. Okay, so let's continue. Okay. Let's wrap up, guys. Let's wrap up. Ask your questions, please. Okay, let's see this one. Doc, is it true that baby delivered at 32 weeks will not survive? You see, when you're pregnant, there are so many silly things you're going to hear from people. So many silly, idiotic falsehoods. And this is what happens. When you don't go through the right channel, when the spirits and Amadioha and all the silly people out there begin to feed you lies, You will become apprehensive. You will be tensed up. You'll be worried. When you go to sleep, you don't sleep. What's going to happen? Your blood pressure is going to go up. Your hormones are going to go all over the place. You can actually have miscarriage. You can actually have stillbirth when you are freaking out for nothing. Now, this is the fact. There are so many babies that will come early. And an example is my daughter. My wife's water broke at 21 weeks. 21. Happily and thankfully, I was around. I had to rush my wife to the hospital immediately. It took them 5 minutes to admit my wife. What happened when we got to the hospital? They immediately went into action. They started running all tests. They admitted us, and we were able to buy extra 5 weeks. So we stayed in the hospital for 5 weeks. So 21 plus 5 weeks is how many weeks? 26 weeks. On the 3rd day, going into the 7th week, 27th week, my daughter was born. So if you follow me, you will notice I have a daughter and a son, right? They are my 2 best treasures. Zara was born at 26 weeks and 3 days. Zara weighed 1 pound, 36 ounces. Zara, when she was born, was a tiny space in my hand. But if you see my daughter now, you will not know she was born at 26 weeks. So the fallacy, the falsehood of the fact that when you have your baby at 22 weeks is completely nonsense. If your baby decides to come early, what we are gonna do is to make sure we administer a couple of preventive and protective drugs. One of the important drugs we will give a woman that will have a baby before 37 weeks is what? Steroids. Steroids will help your baby's lung to mature. Ordinarily, the baby's lung will start maturing at 34 weeks. But if the baby is gonna come before 34 weeks, we are gonna admit the woman and we will give her steroids. When we are giving her steroids, what are we doing? We are building what we call surfactants. Surfactants are substances that will help your baby's lung to perform okay. This is one of the important things we will do when you are on admission and your baby is not up to 37 weeks. 37 weeks is term. When you are pregnant and you achieve 37 weeks, we can deliver you and your baby anytime and you can go home. So any baby that is born before 37 weeks is considered preterm. When the baby is born, we are gonna admit the baby in a special place called NICU, Neonatal Intensive Care Unit. When your baby gets to the NICU, like my daughter, immediately my daughter was born, I was there right in the theater when they sectioned my wife. I had to cut the umbilical cord and they immediately took my baby girl away and they admitted her in NICU. She stayed for almost 5 months before we went home. She was able to receive all the care she needed. Why am I telling you this? When you are pregnant, it's important you use a reliable care facility. It's important you use the best doctors. So if you are in Lagos, when you are pregnant, when you're registering for your ANC, please use the best. Sometimes you might spend more money, but you will be sure your baby will be fine. If you're in Oka, use the best. If you're in Enugu, use the best. Sometimes it's better to spend a lot of money and get what you want than to spend no money and lose what you cherish. No mother deserves to lose her baby. No father deserves to lose her baby. The pain of losing your baby doesn't go away. The pain of miscarriage doesn't go away. You can have 20 kids later, but that one particular baby you lost will live in your heart forever. So please, invest in your family. Pregnancy is something you need to take serious. Pregnancy is not an afterthought. Every singular pregnancy must be fully planned. Every pregnant woman must care for your baby. The first love you can show your baby is to make sure you register for ANC on time and you meet with all your appointments and you take all your drugs. You are not a good mother if you are still drinking, if you are still smoking, if you are dodging class, if you are just careless, if you are using drugs, you are simply not a good mother. You cannot become a good mother. Why? Because you are harming your baby. When you become pregnant, every single thing you do will affect your baby. So my clinic is over, but this is the good news I have for you. By this time next year, by the special grace of God, who made heaven and earth, who has been with us from day one, you are gonna be a mother. You are gonna be a mother of one. You are gonna be a mother of twins. You are gonna be a mother of triplets. You are gonna end this infertility. Nothing can stop you from becoming, except you don't wanna become. Becoming a mother is grossly by choice. Becoming a father is grossly by choice. If you want to be a father in 2022, you can become. What you need to do is to deal with your reality. Then you break away from your society. Then you begin to do what you need to do. You can become a mother, a father naturally. You can become a mother, father through IVF, through IUI, through surrogacy, through adoption, through donor eggs, through donor sperm. They are all okay. So becoming a mother and a father is a question of choice. Admin, capture this for me. So many people are wasting time thinking about DNA, wanting to conform to the society, wanting to please everybody, pleasing your pastors, pleasing the society. At the end of the day, you blink and you are dead and gone, and nobody will continue your family name. Refuse to be the person that will stop your family from perpetuating. You can refuse in 2021 to be alone. You have girls, you have boys in your generation. This is not the end. Infertility ends. I know why I'm saying this. So many people have sold their lives, so many people have sold their soul to religiosity. Unfortunately, the people you're dancing to their tone, they all have their kids. Some of the fraudulent pastors, which you are giving the money, which you are using the money you should use to go and see a fertility specialist, to enrich them. They have their kids, have their grandkids, they have their boys. They come to America. They do every single thing they are telling you not to do. My people, it's all about tricks. You can no longer be fooled. You cannot be in this group and you don't know this. 99% of people out there in religion, they are after your money. Look, I'm keeping it real. So if anybody is discouraging you from going for CS, tell the person, get thee behind me, Satan. If anybody is discouraging you from going for IVF, adoption, surrogacy, tell them, you know what? I don't even want to see you because you don't understand. Why? Nobody is going to feel your pain. When you look around in a big house, in a big car, and you are the only person there, your car and your house is absolutely nonsense if you don't have kids. That's if you want. There are some people that don't want kids. So don't wait till it's late before you begin to come to my inbox and begin to complain. I love you guys. This is my truth, and I stand on my truth. Later this afternoon, join Dr. Ndiche for her clinic, and Dr. Ndiche will help you guys to understand her topic better. Until I see you tomorrow, God bless you and enjoy the rest of your day. Please make provisions for the ovulation and pregnancy boot camp. There is nobody in this group born barren. We don't have any barren SGHS member. We are fruitful. We are mothers. We are fathers. The only thing we are going through is challenge. That we are overcomers. We are survivors. I have been there before, my people. Whatever you are feeling, I have felt it. I have lost my babies. I have gone through infertility, but I'm standing today to testify that infertility ends. So I'm challenging you today to follow through. Don't wait till it's late. So join me later today to discuss pregnancy in a menopausal lady of 60. Is it possible for a woman in her 60 to be a mother? 100%. I love you. God bless you, and bye-bye for now.